Welcome to your 2026 AD Transport Express Open Enrollment presentation. Let's review important eligibility information. Full-time employees who work at least 30 hours per week are eligible for the benefits program. Eligible dependents include your legal spouse and dependent children, who may remain on your medical plan until the end of the month they turn 26. For new hires, coverage for you and your eligible dependents begins on the first day of the month following 60 days of full-time employment. If you elect short-term disability, coverage begins on the first of the month after 12 months of service. Coverage ends on your last day of employment, but you may continue medical, dental, and vision benefits through COBRA. During annual open enrollment, you can make changes to your benefits or dependents. Outside of open enrollment, changes are only allowed with a qualifying family status change, which must be reported to Human Resources within 30 days. Exceptions for Medicare or Medicaid entitlement allow 60 days for changes. Refer to your benefit guide for additional eligibility details. When completing your medical benefit election, take your time and write neatly, especially your Social Security number. An unclear or incorrect number may delay or deny your claims. Select only one medical plan. If you wish to decline medical coverage, check the Waive Medical Coverage box. Review weekly costs for each plan and coverage level carefully to choose what best fits your needs. Here are your medical plan options for the 2026 to 2027 plan year. This slide compares the Priority Health PPO $2,500 plan and the Priority Health POS HSA $5,000 plan. The PPO plan has a $2,500 individual and $5,000 family deductible, with the plan paying 80% after deductible and an out-of-pocket maximum of $6,350 for individuals and $12,700 for families. Copays for primary care are $30, specialists $55, urgent care $75, and ER $350. Preventive care is covered at 100%. The POHSA $5,000 plan is HSA compatible with all services subject to a $5,000 individual or $10,000 family deductible and an out-of-pocket maximum of $6,750 for individuals and $13,500 for families. Preventive care is covered at 100%, and all other services are covered 100% after the deductible. Prescription copays and requirements for PCPs or referrals are noted for each plan. Out-of-network care is covered at higher costs, and out-of-state services with participating Cigna providers are covered at in-network rates. See your enrollment form for medical rates. A health savings account, or HSA, pairs with a high-deductible health plan, specifically the Priority Health POS HSA $5,000 plan. Use it for medical, prescription, dental, and vision costs. The HSA is entirely yours, even if you leave the company or retire, and any unused balance rolls over year to year. HSAs offer tax-free contributions, growth, and withdrawals for qualified expenses. For 2026 to 2027, the contribution limit is $4,400, or $4,500 for employee only, and $8,750, or $9,000 for dependent coverage, with an additional $1,000 catch-up allowed for those over 55. Remember, with the HSA plan, you pay full costs until you reach your deductible. Then insurance starts to help pay. If you are turning 65 soon, you may be eligible for Medicare. Medicare covers people age 65 or older, and some younger individuals with certain health conditions. Becoming eligible means you need to decide when to enroll, which parts you need, and how it works with your current coverage. Making the wrong choice or enrolling late can cause gaps or extra cost. We work with a Medicare specialist who can help you understand your options, enroll on time, and transition your coverage smoothly. If you have questions, contact HR to be connected with our Medicare specialist. Next, we will review your dental and vision plan options for the upcoming year. You have two dental options, the base plan and the buy-up plan. The base plan covers only in-network providers, while the buy-up plan offers coverage for both in- and out-of-network care. Preventive services are covered at 100%, and both plans have deductibles and annual maximums, $1,000 for the base plan and $1,500 for the buy-up plan. Basic and major services are covered after the deductible, with coinsurance levels as shown. Orthodontics are not covered. No physical dental cards will be mailed. The Vision Plan through Guardian VSP allows you and your family to visit any provider, but you save more with in-network options like VisionWorks and Pearl Vision Centers, or online at iconic.com. Eye exams have a $10 copay, and lenses are covered at no cost in-network. Frames are covered at 80% of the amount over $150. Contact lens benefits are detailed in the plan. Eye exams and lenses are covered once per year and frames every 2 years. No physical vision cards will be mailed. Rates are on your enrollment form. Your good health matters. To participate in AD Transport's wellness program, you must be enrolled in a Priority Health Medical Plan on August 1, 2026. Complete your annual physical exam between June 1, 2026 and June 1, 2027 and sign the HIPAA authorization member form to have a $25 per month wellness credit applied to your medical premium starting August 1, 2027. Only your name and date of physical are shared with AD Transport, no other information. Physicals do not qualify. It must be a preventive exam with your primary care doctor. Let's review the voluntary benefits available during the 2026 to 2027 plan year. You may elect Guardian Voluntary Life Insurance for yourself, your spouse, and your dependent children. Employee coverage is available in $10,000 increments up to $300,000, with a guaranteed issue of $250,000 when first eligible. Spouses can be covered in $5,000 increments up to $200,000, with a $25,000 guaranteed issue if under age 70. Dependent children can be covered for $5,000 or $10,000, with a $500 benefit for infants under 14 days. Accidental death and dismemberment matches your coverage amount. Coverage reduces by 50% at age 70, and plan features include portability, conversion, waiver of premium, and accelerated life benefits. Evidence of insurability is required if you enroll later or for higher amounts. Eligible employees with at least 1 year of service can enroll in Guardian Voluntary Short-Term Disability Insurance. Benefits begin after the 7th day of disability due to accident or illness and pay 60% of your base weekly earnings up to $1,000 per week for up to 13 weeks. This benefit may be reduced by other income. If you do not enroll when first eligible, you must complete evidence of insurability to add coverage later. This is a 100% employee-paid benefit. The Guardian Accident Plan pays set benefit amounts for accidental injuries and treatment, including emergency room visits, child sports accidents, burns, concussions, dental or eye injuries, ruptured discs, and more. Benefits are paid directly to you. The Critical Illness Plan pays a lump sum if you are diagnosed with a covered condition, such as cancer, heart attack, stroke, organ failure, permanent paralysis, or advanced multiple sclerosis. Employees can select $10,000, $20,000, or $30,000 coverage. Spouses are eligible for 50% and children for 25% of the employee amount. No evidence of insurability is required if you enroll when first eligible or during open enrollment. The Guardian Hospital Indemnity Plan pays cash benefits directly to you for hospital or ICU admissions. $1,000 per admission, limited to 1 per insured and 3 per family per year. It also pays $200 per day for hospital or ICU confinement, up to 15 days per year per insured. You can use these payments for any expenses. Pre-existing condition limitations apply. See the plan booklet for details. The Guardian Employee Assistance Program, provided by ComPsych Guidance Resources, offers confidential counseling, expert guidance, and valuable resources. You can access 3 face-to-face or virtual sessions per issue per year for emotional support, and resources for work-life balance, legal and financial matters, online will preparation, and wellness coaching. Digital support and on-demand trainings are available, and all services are accessible 24/7 by phone, online, or through the Guidance Now app. Once your coverage starts, download the Priority Health app and sign into your account to access your digital ID card immediately. Try to schedule non-urgent doctor appointments 1 or 2 weeks after your plan's start date to avoid issues if your card or member number hasn't arrived. If you have questions, contact your HR team for assistance. Thank you for reviewing your 2026 to 2027 benefits options with AD Transport Express.